My prescription for everyone in this situation is probably to include some sort of ethical reasoning courses and with specific focus to care practitioners in schools, So like Creighton has these sorts of classes. And hopefully I'll start an ethical discussion group at the University of Washington and go into this. They cover it, but probably not as specifically as it should be covered if people are going to choose to face situations like this.
And my prescription to you, physician, is to heal thyself. that should start in medical school, and it needs to be the professional pattern. Because the conversation with people like you or whomever, this helpfulness is the one that I think sustains us over a lifetime. So, questions from the audience?
We'll go here first. I saw her first. Back over.
Well, this is actually kind of jumping off the Dr. Regis thing. As you know, I'm quite familiar with the UW Medical School, and you mentioned kind of Creighton and how they have this system in place, and you're probably quite well aware that UW has a tiny bit of it, but what it's really skewed to kind of the liberal think what you think or just don't say anything. And
It's just worked well with me so far. Right?
What?
It just worked well with me so far. Right?
Obviously. So what? This was excellent. Obviously, you put a lot of like heart and emotion and thought and critical thinking into all of this. What concretely can you take from your thesis that's going to provide you the strength to fight against the system in your medical school?
More concrete. Conviction. You have these sort of ethereal thoughts as you're going through, like, yeah, I'm going to be patient first no matter what, right? And then as things go on, what happens is you get blunted and napped as you move through, there you go, Dr. Bowie, through the system and into your career. And I think if you don't have a firm foundation and conviction before you move on, you're in danger of losing sight of what is and should be most important to you. Fortunately, I'm German, so once we take hold of the idea, it's pretty concretely in there. And I've definitely come through some very firm convictions as I've worked through this plethora of stuff. So that's probably it. I'll go Martin and Tim.
So, Jeff, great job. You talked about, in a perfect world, autonomy would be the option. And then you were brought back to imperfection with Dr. Clayton. And so your compromise was then discernment. Can you talk a little bit about how those differ in this context? Because
how discernment differs?
Well, you know, autonomy, someone gets to make a choice based on what they're willing to do.
Yeah.
Tell me how this differs from discernment in this case.
I would say that this is where I go to personal experience. I've shadowed physicians who could never justify taking part in the system, right? That's their discernment. And then I've read amazing arguments that I disagree with by brilliant and incredible physicians who are deeply embedded in the system and make arguments all the way for it. So as much as I'd like the Pentagon to call me and ask my opinion, there are a lot more well-qualified, experienced, brilliant physicians out there who've decided that this is okay, that they can be all right with this. Because of a slightly different way in the way they view the world. While my whole move with discernment is, it's not saying that the person who's in the system can do whatever they want. It's done before you choose to move in or to move into civilian. And you're going to face some like Dr. Shimia says, some issues in a civilian sense, minor compared to the military. But hopefully you can do that discernment beforehand and prepare yourself for whatever you're going to choose to do. So that's where they would differ.
Okay, so it's not at the point of decision, it's whether or not to enter the system.
Yes, prior to. Yes,
thank you
absolutely.
for the clarification.
For those of us who are realists, we live in a world of trade-offs. So obviously there are those who disagree, but approaching this from that schematic, what are the potential consequences of getting rid of a system of utility? What advantages does this system offer that scrapping it or altering it may result in?
If we were to scrap the entire system?
Or alter it, what are the potential consequences? What advantages does this system offer us that we might lose?
I got into this a little bit, but I'll try and make it more explicit. If we were to offer more autonomy to the physician in combat, the more you offer, it's directly proportional to the amount of danger you run of going contrary to combat operations, right? So you have these two conflicting models. You have care for the person, care for the whole person, that stems into patient healing, right? And patient-physician care. And then you have conservation, preservation of the fighting force, which is the Army's medical motto, right? And you can see where those don't overlap. And the more you go to one, the more you lose sight of the fighting force. And the whole reason we have an army is to fight effectively. So that is the real consequence of immediate more autonomy in immediate decision making as a military physician right there.
So I guess what I'm really saying is, what are the advantages of the system we have in place now? Or are there any in your evaluation?
The advantages are that we enjoy right now in Iraq and Afghanistan the lowest amount of combat death directly related as we've ever had. So the system is really polished. It works well 92 to 96% of the time. And then those others are unfortunate circumstances that I see as a minority circumstance, but in my opinion, there's no reason Specialist Chatre Clark should have passed away. There's absolutely no reason. So the advantage is utility. Any more? Hey.
Would you ever consider, I know you're going to med school on, you told me once what you're interested in doing, but I didn't understand it. But would you ever consider doing medical work with the Army or military, given your thesis and everything?
You're gonna put me on the spot like that, right? I'd say no, I'm not going to have the military pay for my medical school. I'm not going to have, I'm not saying that's the incorrect choice. I'm just saying I can't personally do it. When I would is, for instance, the earthquake in Haiti, we have Navy SEALs deployed to bring relief, right? That's technically not the Navy SEALs' job or the Navy's job, but they take civilian doctors with them when they do things like that, and I'd have absolutely no issue working like that. I would have a tough time working in combat field of operations as a surgery person in a field hospital in Fallujah or something. I would have a very difficult time doing that.
I think we're at the place where we should probably congratulate Jeff for the wonderful work and discernment that he's done. And invite you to celebrate with him and ask difficult questions in private.